What's the best blood pressure for older adults? It's a common misconception that blood pressure is a simple black and white issue with a singular normal number and a definitive high number. However, the reality is far more intricate. Blood pressure is, in fact, one of the most intensely personal metrics in the entire field of medicine. What might be perfectly acceptable for one individual could be a cause for concern in another, even if they share the exact same numerical reading. This nuanced reality underscores the importance of a personalized approach, especially when it comes to managing blood pressure in older adults. In this discussion, we aim to illuminate the ideal, individualized blood pressure targets for those aged 60 and above. We will delve into the true implications of major blood pressure studies for your personal health, moving beyond the headlines to understand what these findings truly mean for your unique physiology. Crucially, we will also outline a practical framework, the very system employed by healthcare professionals for their own patients, to establish a safe, customized, and effective blood pressure goal. Let us begin by dismantling the most pervasive myth surrounding blood pressure management, the notion of a universal one-size-fits-all target. While clinical guidelines do establish defined categories for blood pressure readings, ranging from optimal to stage 2 hypertension, these labels primarily serve to classify your numbers. They do not, however, offer insight into whether a particular reading is truly safe for your individual body. These guidelines cannot tell you if your brain is receiving adequate blood flow, if your kidneys possess the resilience to metabolize prescribed medications, or whether actively lowering your blood pressure would be beneficial or conversely, potentially detrimental. The safety and efficacy of any blood pressure target are profoundly influenced by a constellation of personal factors. These include the inherent stiffness of your arteries, the presence of symptoms such as dizziness, cognitive cloudiness, or persistent fatigue, your susceptibility to falls, the sheer quantity of medications you are currently taking, the current state of your kidney function, your overall cognitive health, your typical activity level, and your body's unique responsiveness to specific therapeutic interventions. This is precisely why one individual might present with outwardly perfect health and a blood pressure reading of 118/72, while another, at that very same number, could be experiencing significant discomfort, characterized by dizziness, profound fatigue, and an unsettling sensation of impending collapse. This stark contrast highlights the critical need to look beyond the numerical value itself and consider the individual experiencing it. This brings us to a pivotal question. How does one ascertain their specific physiological category and determine their unique ideal blood pressure? Fortunately, 2 significant studies involving older adults and blood pressure offer valuable insights, though their true meaning is often obscured by a failure to examine the finer details. Let us explore these landmark trials. In 2015, the SPRINT trial was conducted, involving a cohort of 9,361 adults aged 50 and over, with an average age of 68. This study meticulously compared 2 distinct blood pressure targets. One group, designated as the intensive group, aimed for a systolic blood pressure of less than 120. The other, the standard group, had a target systolic blood pressure of less than 140. The findings of the SPRINT trial were compelling. The intensive group, those actively striving for a systolic blood pressure below 120, experienced a statistically significant reduction in the incidence of heart attacks, strokes, and cardiovascular deaths. Based on these results, one might be tempted to conclude that aiming for a systolic blood pressure below 120 is a universal prescription for improved cardiovascular health. However, this conclusion would be an oversimplification and, in some contexts, inaccurate. The same intensive group also reported a higher prevalence of adverse effects, including dizziness, fainting spells, electrolyte imbalances, kidney complications, and an increased risk of falls. Therefore, while pursuing a blood pressure below 120 might mitigate the risk of cardiovascular events like heart attacks and strokes, it can also lead to a state of hypotension so profound that it causes debilitating symptoms such as dizziness and even syncope, fainting. This loss of consciousness can result in falls, leading to potentially fatal injuries, including intracranial hemorrhages. This illustrates a critical trade-off. While reducing cardiovascular risk, an overly aggressive blood pressure target can introduce other significant dangers. Now, here is a crucial aspect of the SPRINT trial that is often overlooked. The trial's design inherently excluded a considerable number of patients who represent the complexities of real-world clinical practice. Specifically, the SPRINT trial did not include individuals with diabetes, those who had experienced a prior stroke, individuals diagnosed with dementia, patients with advanced kidney disease, or those exhibiting severe frailty. In essence, the SPRINT trial evaluated the benefits of a blood pressure target below 120 only in a select population of robust, resilient, and active older adults, rather than the broader, more diverse elderly demographic. Complementing the SPRINT trial, the STEP trial was conducted in China in 2021, enrolling a total of 8,511 adults between the ages of 60 and 80. This study mirrored the design of the SPRINT trial, again comparing an intensive target of less than 120 systolic blood pressure against a standard target of less than 140 systolic. Predictably, the results echoed those of the SPRINT trial. The group aiming for lower blood pressure experienced fewer cardiac events, heart attacks, and strokes. However, once again, this group also reported a higher incidence of side effects such as dizziness, strain on the kidneys, and fainting. So, what are the practical implications of these two significant trials for you as an individual? If you are over the age of 60, maintain a regular walking routine, are highly independent, possess good cognitive function, have no pre-existing kidney issues, and are not taking a multitude of medications, then a systolic blood pressure target of less than 120 might indeed be beneficial for you. However, if you fall into the category of being 60 or older and are managing multiple chronic medical conditions, are taking 4 or more medications, have compromised kidney function, experience frequent dizziness, or have a history of falls, then aggressively pursuing a blood pressure of 120 is not only unwarranted, but could potentially be hazardous. The pursuit of such a low target in these circumstances could lead to a cascade of adverse events that outweigh the potential cardiovascular benefits. This leads us to the vital question of how to determine if your current blood pressure target is too low for your specific body. Fortunately, your body provides clear warning signals that indicate your blood pressure may be excessively low. If you experience any of these signs, it is imperative to reassess your current medication regimen and consider a reduction. These warning signs include severe lightheadedness upon standing, so intense that you feel as though you are about to lose consciousness, persistent dizziness, particularly upon waking in the morning, pronounced brain fog, overwhelming fatigue, a sensation of unsteadiness or feeling off balance, the occurrence of muscle cramps or electrolyte disturbances, or if your blood pressure regularly drops below 100 systolic. If you are experiencing any of these symptoms, it is your body's unequivocal communication that your blood pressure is too low for your physiological needs. While a lower blood pressure is generally desirable, it should never come at the expense of your body's fundamental functioning and well-being. This brings us to the million-dollar question, and one that you are likely pondering right now. What exactly is my ideal blood pressure target? Herein lies the precise framework that is utilized for approximately 95% of all patients. For individuals between the ages of 60 and 79 who are active, independent, and do not grapple with significant chronic medical conditions, aiming for a blood pressure of less than 130/80 is generally considered appropriate. Conversely, if you are within the same age range, 60 to 79, but experience dizziness, exhibit frailty, manage multiple medical conditions, or are taking numerous medications, a target of less than 140/90 is often a safer and more suitable goal. For individuals aged 80 and above, the target blood pressure generally falls within the range of 130 to 150 systolic, with the exact target being contingent on the presence and severity of symptoms. It is important to note that if you are in this age group and can comfortably maintain a blood pressure of 120 or lower without experiencing any adverse side effects, this could offer additional cardiovascular protection, but only if you feel well and are free from symptoms. This personalized approach explains why two individuals presenting with identical blood pressure readings may necessitate entirely different treatment plans. It is this meticulous attention to individual variability that truly defines nuanced blood pressure management. It transcends the mere adherence to guidelines. It is about treating the whole person, not simply a number on a chart. Should you find this information beneficial and desire to delve deeper into creating a personalized blood pressure management plan, particularly one focused on the most effective natural methods for lowering blood pressure, I have compiled a comprehensive 49-page document. This guide, which I've named My Blood Pressure Reset Guide, encompasses everything you would ever need, from specific dietary plans and appropriate exercise regimens to evidence-based supplement recommendations, all meticulously designed and targeted to help you naturally lower your blood pressure. If you are interested in exploring this resource, you will find a link to it in the description below. As a source of comfort and strength, remember the words from Psalm 46:1. God is our refuge and strength, a very present help in trouble. Establishing your ideal blood pressure target is a cornerstone of effective long-term management, but it represents only one piece of the comprehensive blood pressure puzzle. It is equally crucial to ensure that you are obtaining accurate blood pressure readings in the comfort of your own home. To achieve this, it is vital to be aware of and avoid the top 10 most common mistakes that I consistently observe patients making. You can learn about these critical errors and how to circumvent them by watching the video presented right here.